Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Rickettsia under the section of infectious diseases. So this is just a picture of Rickettsia. It's really quite unlikely for them to ask you to identify this on the MRCP exam, but it's always good practice to have a broad understanding of what these different types of organisms look like under the microscope. The epidemiology of Rickettsia is that it is transmitted to humans via a number of arthropods, and it has a global distribution. So overall, there are two important types of Rickettsia that you certainly need to know about for the MRCP examinations. Type 1 is typhus and type 2 is spotted fever. Let's start with typhus first. So this is an endemic typhus, and the leading organism is secondary to Rickettsia prowazekii. The vector of it is the body louse, and in terms of its distribution, it is commonly found in South America, Africa, and Asia. The second type that comes under the typhus group is endemic murine typhus, which the causative organism is Rickettsia typhi. Vector is the flea, and it can really be affected anywhere in the world. The last group of typhus that you need to know about is the scrub typhus. This is caused by Rickettsia susugamushi, and larvar trombicled mite is the vector. It is commonly found in Southeast Asia and South Pacific. Now, talking about the second group of Rickettsia, which is the spotted fever types. This is really broadly divided into three different types. Type 1 is the Rocky Mountain spotted fever. Type 2 is the Old World or the Bhutanese spotted fever. And the type 3 is the Rickettsia pox. So let's talk about the Rocky Mountain spotted fever, which is probably the commonest type that you need to know about. This is caused by Rickettsia rickettsii. It is a tick-borne disease, and it is predominantly, as the name suggests, found in the Rocky Mountain area of the USA. The Bhutanese or the Old World fever is caused by Rickettsia connery. It is again a tick-borne disease, and it is found commonly in Africa and the Mediterranean region. Rickettsia pox, which is the third type, is caused by Rickettsia acari, and this is a mite vector, which is more commonly found in Africa and Asia than in the USA. So the pathophysiology of this is a zoonotic infection, and it is caused as a result of a small aerobic gram-negative obligate intracellular bacterium. So those are really important because they can give you the description of the organism, and then they ask you to pick the correct option based on that. The clinical manifestation of this is commonly manifested through fever, headache, and rash. There are many associated cases that are commonly found with an eschar, which is basically the specific type of rash that you get at the site of the bite, and very frequently is also associated with regional lymphadenopathy. The picture shows a case of Rocky Mountain spotted fever, and that's the classic type of rash that you would be expecting in a case of Rickettsia. The management of this, on the other hand, is really quite straightforward and simple, and it is with a tetracycline antibiotics such as doxycycline. So let's do a question. A 40-year-old man presents with a high fever, severe headache, and a maculopapular rash that started on his wrists and ankles and has spread to his trunk. He reports recent hiking trips to the Rocky Mountains. Which of the following is the most likely diagnosis? Option A is epidemic typhus. Option B is endemic typhus. Option C is a scrub typhus. Option D is Rocky Mountain spotted fever. And option E is Lyme disease. So this was a really straightforward question because the biggest giveaway is that he's traveled to the Rocky Mountain regions and he's coming in with quite classic features with high fevers, headaches, as well as a maculopapular rash. So really the correct option is going to be option D, which is the Rocky Mountain spotted fever. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.